Hi, I'm Steve Poftak, General Manager of the MBTA. Last week, Governor Baker issued an executive order requiring the use of masks or face coverings in public places. The statewide order went into effect May 6th. The order specifically requires people to wear a mask or face covering at all times when using public transit, including on MBTA vehicles and in stations and at stops. The order requires all residents over the age of 2 to use a face covering or mask in public places where maintaining proper social distancing to prevent the spread of COVID-19 is not possible. A face covering may include anything that covers your nose and mouth, including a mask, scarf, or bandana. Healthcare masks should not be used and should be preserved for healthcare workers and first responders. I welcome the governor's executive order, and it raises questions for the MBTA that we should address at the outset. First, how will the MBTA enforce the order at our stations and on our vehicles? We fully expect our riders to comply with the governor's executive order to wear a face covering and practice social distancing to the greatest extent possible while riding on the MBTA. The only exception to the order is for people who are unable to wear a mask or face covering due to a medical condition. The MBTA is not in the business of determining a rider's medical condition, nor should we be, and we are specifically prohibited from asking a rider about their medical condition. The MBTA will not deny service for a rider not wearing a mask or face covering, but for riders who are able to wear a mask or face covering, we are strongly encouraging you to do so. For ride customers, because this is a door-to-door service requiring close contact between driver and customer, we are providing our reservation personnel with special instructions for our customers. If riders are not adhering to public health guidance, what will the MBTA do? Based on our observations and reports from drivers and operators, the vast majority of riders are complying. And for those not wearing a face covering, we need to reach them. We need to teach and reinforce a new behavior for this new normal. So the MBTA is launching Ride Safer, a public awareness initiative to promote a safer travel environment. We will do this through communications in our stations, on our platforms, and on our vehicles. We will use our social media channels and the local news media. The goal of this will be to educate riders and shift behavior for a new way of riding on the T that helps keep us all healthy and safe. And how does the governor's order affect the MBTA workforce? For us, we are all required to wear face coverings while safely performing our duties. This applies to all employees system-wide. As Dr. Ashish Jha, professor of global health and director of the Harvard Global Health Institute, mentioned in one of my previous videos, when it comes to wearing a face covering, the purpose is to prevent the spread of the virus. We wear the covering to protect the health of those around us, colleagues and riders alike. Our ability to remain a functioning transit provider is due in large part to our dedicated workforce that comes to work day after day. Employee absences are stabilizing, and I feel we are slowly turning the corner. For those employees returning to work after recovering from the virus or caring for a loved one, welcome back and thank you. And for all MBTA employees, thank you for all you do at the MBTA. By mid-May, Governor Baker will release a plan for a safe, phased reopening of our economy. Whenever that announcement comes, we will work to provide T-service that is flexible enough to adjust to new information and new conditions while keeping riders and employees as safe as possible. A transition work group of T employees has already been established to weigh options and develop contingency plans to be used whenever the governor starts to reopen the economy. The decisions we make will be guided, as always, by thoughtful public health practices and the flexibility necessary to match increased ridership and service with the health and safety of our employees and riders in mind. Thank you for watching today, and I welcome your comments.